The genus Helicobacter are spiral-shaped gram-negative organisms. You can see them in this micrograph right here. They usually have flagella to help with motility. Depending on the species, they can colonize different areas of the GI tract, but the major species that we will talk about is Helicobacter pylori, which is associated with gastritis, peptic ulcers, and is one of the few bacteria associated with cancer. Normally, when we talk about infectious diseases that cause cancer, we're talking about viruses, but this is a bacteria that can cause cancer. Helicobacter species are highly motile because of that polar flagellum they have. They're shown right here in this micrograph. They are urease positive, and they can block acid production. So urease is an enzyme that breaks down urea, and the ammonium produced by the breakdown of urea causes the pH to raise. So this is one of the ways that Helicobacter can use to actually colonize the stomach. The stomach pH is very, very low, but because of the production of urease, the bacterium can lead to a raising of the overall pH of the stomach. It is catalase and oxidase positive. Catalase will help it to evade the immune system. Even though it is gram-negative, it has LPS. The LPS of Helicobacter usually isn't very immunogenic, so that's another mechanism the bacteria can use to hide from the immune system. And the reason that the LPS is not highly immunogenic is because the O antigen of the LPS actually sort of resembles blood group antigens. So the body sort of recognizes Helicobacter as self instead of as an invader. This bacterium is difficult to isolate in culture. It is very small, a lot like Campylobacter, so it would be filtered out normally using a standard filter, but it has specific growth requirements that are just really tricky. It produces a number of different virulence factors, particularly Helicobacter pylori, the species that will colonize the stomach. So it produces a mucinase to help degrade the stomach mucus that protects our cells from the stomach acid. And it can produce phospholipases to destroy host cells. It produces a toxin called vacuolating cytotoxin, which also causes cell death. There are a number of genes under the control of various regulators that are expressed during infection. Another one is cytotoxin-associated gene. So all of this taken together hopefully begins to give you some idea of how Helicobacter can cause ulcers. It degrades the mucus protecting the stomach. It causes damage to the host stomach lining directly. And so because of the exposure of the stomach lining to acid, because it's no longer protected by the mucus, and these enzymes produced by the bacterium and the toxins produced by the bacterium, you start to get that tissue destruction in localized parts of the stomach. Helicobacter pylori also contains a pathogenicity island. This pathogenicity island encodes a type 6 secretion system and can lead to IL-8 production. So the type 6 secretion system is similar in a lot of ways to a type 3 secretion system, in that it's like this injector that will inject molecules into other cells. And the structure of the type 6 secretion system looks a lot like a bacteriophage. So the evolutionary thought process is that bacteria that have a type 6 secretion system co-opted bacteriophage genes to make their own nasty little device. The IL-8 production induced by Helicobacter pylori is associated with increased inflammation. This is a pro-inflammatory cytokine, which can also, again, pro-inflammatory cytokines are good in some respects. It's always good to have some inflammation when you have an infection, because that inflammatory process can help lead to a cleanup of the infection. However, the amount of IL-8 production, if it's a little too high, can lead to dangerous types of inflammation. For example, high levels of IL-8 expressed in the mouth can lead to gingivitis. On the skin, it can lead to psoriasis. So in the gut, in the stomach, when induced by Helicobacter pylori infection, this can again mediate some of that tissue inflammation that can lead to ulcers and eventually the development of gastric cancers. Helicobacter pylori was first isolated in 1984, and I'm going to read you this case study of things you should never ever do and how you can win a Nobel Prize if you do those things. So in 1984, Australian physicians Marshall and Warren reported a discovery that completely changed the approach to the treatment of gastritis and peptic ulcer disease, as well as set the foundation for the understanding of the cause of gastric adenocarcinomas and mucosa-associated lymphoid tissue lymphomas. In an analysis of gastric biopsy specimens from 100 consecutive patients, they demonstrated curved gram-negative rods resembling Campylobacter in 58 patients. The bacteria were observed in most patients with active gastritis, gastric ulcers, and duodenal ulcers. Although similar organisms were observed associated with gastric tissues 45 years earlier, this report stimulated resurgence in investigations of the role of this new organism in gastric disease. Despite the skepticism that greeted their initial report, the significance of their work, it should say, with Helicobacter was recognized in 2005 when they received the Nobel Prize in Medicine. So what was the thing that they did that you should never do? Well, Marshall was really frustrated because when they published these studies, like in 1984, showing this really high correlation of this new bacterium with ulcers, people basically didn't believe it. And so what he did, what you should never do, is he drank a culture of Helicobacter pylori. And he was waiting for the development of ulcers, which he got. Within a couple of days of consuming that culture, he began to experience symptoms of very bad breath. And bad breath is a key symptom of Helicobacter pylori infection, because what's happening is the bacteria are raising the pH of the stomach, so more and more bacteria are able to survive in there, and the byproducts of that bacterial metabolism come out of your mouth as bad breath. He did develop ulcers. He eventually took antibiotics and cleared his infection, but that's partly how they got the Nobel Prize. It's estimated that in developing countries, like 70 to 90% of people are colonized with Helicobacter. It's less than 40 in the US. And the bacterium is isolated from 70 to 100% of patients with ulcers. Interestingly, it does appear to protect against acid reflux and adenocarcinoma of the esophagus. So what can happen in acid reflux is if the stomach acid goes up into the esophagus, you have that continued inflammation, the continued tissue damage. That continued tissue damage and that cycle of constant repair is what can eventually lead to cancer development. So having Helicobacter infection in the stomach, because it raises the stomach pH, it prevents that reflux and the development of cancer in the esophagus. But the problem is, because of the ulcers that form in the stomach and the constant repair of the damage caused by the ulceration in the stomach, you then are more prone to stomach cancer. and this is transmitted through the fecal-oral route. The disease that is caused by Helicobacter pylori is related to the site of the infection. Anywhere from 10 to 15% of patients with gastritis will develop peptic ulcers. So what you see in this image here is asymptomatic or chronic gastritis. The patient just constantly has inflammation in the stomach. It's responsible for 85% of gastric and 95% of duodenal ulcers. And you can see the ulcers forming here. And of course, then you get the increased risk of gastric cancer. I mentioned earlier that one of the really common symptoms of Helicobacter pylori infection is bad breath. It can be diagnosed through histology of a gastric biopsy. Because the bacteria are so small, you often can't see them under classic stains, but if you use a type of silver stain, you can see the bacterium. You can also test for the presence of the enzyme urease. It's a very easy biochemical test. There are a number of immune assays available. And as I mentioned, culture is difficult. It can take up to 2 weeks. So you can do selective growth media, look at the morphology under a microscope, and then do oxidase, catalase, and urease tests. What generally is prescribed as therapy for patients with Helicobacter pylori is a proton pump inhibitor, along with a macrolide and a beta-lactam. And the reason that you're going to have the proton pump inhibitor is to limit the amount of acid that's being produced in the stomach. And that sounds counterintuitive, but the problem is that until the infection is cleared, any acid produced in the stomach is going to just constantly be damaging the stomach lining because the bacteria are breaking down that mucus layer. So patients are prescribed a proton pump inhibitor so they stop causing their own tissue damage and the antibiotics to clear the infection. And then once the infection has resolved and the mucus layer goes back to normal, the patients can discontinue proton pump inhibitor therapy so that they can make their normal stomach acid again.